there was press coverage of a couple, young, mid-30s. The husband had quick onset kidney disease. And he went from an extremely healthy mid-30s father and stepfather raising 6 children to critically ill very quickly. His wife offered to donate kidney to him, and she was tested. And unfortunately, she was not a match for him. But what she said was, look, and this happens with some degree of frequency, if a kidney transplant program can find a kidney for him, she will donate a kidney to whoever she is a match for. And that was so emotionally wrenching to me that I couldn't stand it. So I talked to my wife and I said, you know, I am, mid-50s. I'm very healthy. I want to check and see if I could donate a kidney to somebody. And I made what was certainly one of the strangest phone calls of my life. And so that started down a path of working with them. Jerry Goldman, who is the living donor coordinator at Harrisburg Hospital, who is just wonderful. She was the person that I worked with the whole time there. So we scheduled a date of my surgery, and it's late April 2010. And along the way then, what they also figured out, what my kidney was going to do was start a small chain. And so what happened was, my kidney was going to go to Baltimore, and that was going to result in 3 more kidneys being freed up. And what happens is, my recipient had someone in her family who was a pair with her and said, you know what? If she gets a kidney, I'll donate a kidney. And that kidney went, we learned later, went up to New York, to Cornell. And a kidney there was freed up, same thing, came back to Harrisburg. And that freed up another kidney as well. So my surgery at Harrisburg Hospital was done amazingly. I mean, I have 4 small 1-inch or less scars here where they inserted instruments and cameras, and then I have about a 4-inch incision around where my swimsuit would be, where the kidney was removed. You can only see a handful of little scars here, that's it. And it was just an amazingly, given that they remove a healthy living organ, the small amount of surgical scars that you have is truly incredible. 2 things strike me about organ donation. Number 1, in my opinion, every single person should have on their driver's license the organ donor designation. When the time comes and you're gone, like they say, you cannot take your organs to heaven. They can save so many lives. That's easy. The second issue is living donation. And I would just say to folks, if they are in a point in their life where they want to consider this, having done it and survived it and living it every day, I have absolutely no regrets. I couldn't imagine not doing it. And I wouldn't change one thing about what I went through and what happened to me and the end result, which is I know there was a recipient and actually 3 other people. There's 4 recipients right now that have new, healthy kidneys and are living life. And without that, we would have 4 very sad stories. 24 hours after my surgery, Jerry Goldman comes into my hospital room and says, all 4 recipients have kidneys. And they're all working. And all 4 donors are fine. So you have 8 operations in 24 hours and 8 people are all doing well. outwardly, the only thing that's changed for me is these little surgical scars that I see in the morning when I'm getting out of the shower. And I'm amazed that again, I would have no idea that I donated a kidney. Inside, though, I'm so happy for Pat and her family and for these other recipients. I'm just happy that they have another shot at a full, complete life, wherever it's going to take them. And it just makes you, sometimes you realize, in the face of all the badness in the world, that there are moments where good things can still happen. What is also amazing is that here I am, and here's a woman 90 miles away in Baltimore. We'd never met. We are as different as night and day, and yet she and I are perfect biological matches, which says to me that the family of humanity, they're truly color, gender, ethnicity, nationality, religion, they all fade away. At that core, we're all human beings, and we need to take care of each other.
Hi, I'm Patty Bucek with the Kidney Foundation of Central Pennsylvania. Since 1979, our organization has been dedicated to providing health education and outreach about chronic kidney disease, services and support for people whose lives are impacted by kidney disease, and advocacy for more living organ donation in order to reduce the wait for a life-saving kidney transplant. We do this in a variety of ways, through free screenings in the community, through services for people with end-stage renal disease and on dialysis, and through helping people understand the living organ donation process. Our Patient and Family Partner Program matches patients and caregivers with trained mentors who have traveled down the same path that others are about to step foot on, and provides much-needed support and encouragement. We need your help in order to raise the level of awareness about kidney disease and organ donation, in order to help people understand what it means to be a living organ donor and give that most important gift of life.